Hi all. Where there is health, there is beauty. The true beauty of a woman is in her health. The next 20 minutes is really going to be very important. I am here to talk to you about breast cancer, one of the biggest threats to today's women. Breast cancer is the second leading cause of cancer death in women. It's the disease women fear most. Breast cancer can also occur in men, but it is far less common. What is breast cancer? Breast cancer is the most common malignant condition of the breast. Malignant refers to the cells that grows out of control. Let's watch the video for further understanding.
Breast cancer affects around 1.5 million women worldwide. While earlier detection and better standards of care have increased response rates, many will have their breast cancer recur. Thus, new approaches are needed to prevent disease recurrence. Despite attaining remission with standard of care, residual cancer cells can remain. These cells can travel through the circulatory system and migrate throughout the body. Here, one or more breast cancer cells have migrated to this bone site and has begun growing. If not stopped, this micrometastatic nest of cells will grow until it is able to be diagnosed as a metastatic tumor mass. HER2 is a protein product of an oncogene that is highly overexpressed by approximately 85% of breast cancer cells. In vitro and in vivo studies have identified the Nuvax peptide sequence as being the most immunogenic fragment isolated from the extracellular domain of the HER2 receptor. Nuvax is injected with a simple intradermal injection along with an immunoadjuvant. Upon injection, localized antigen-presenting cells, known as APCs, pick up Nuvax on specialized surface receptors. These loaded APCs then migrate to the lymph nodes, where they bind to T cells with specific HER2 receptors on their surface. Upon binding, a rapid expansion of T cells specific for HER2 expressing proteins takes place. Millions of Nuvax-specific T cells leaves the lymph nodes and circulates throughout the body seeking out HER2-expressing cells and micrometastases. Upon binding of these Nuvax-specific T cells to the HER2-expressing tumor cells, the T cell neutralizes and destroys the tumor cells. Clinical data has indicated the ability to maintain a long-term elevated level of Nuvax-specific T cells, potentially providing long-term protection against the possibility of a tumor recurrence.
Signs and symptoms of breast cancer. Finding a breast cancer as early as possible gives you a better chance of successful treatment. A lump in the breast or armpit. Most of the breast lumps aren't cancers, yet the most common sign of breast cancer for both men and women could be a lump in the breast. Often the lump is painless. The other signs and symptoms of breast cancer could be a bloody nipple discharge, inverted nipple, orange peel texture or dimpling of the breast skin, breast pain or sore nipple, change in the size or shape of the nipple or breast. Causes of breast cancer. Getting older, genetics, certain types of breast lumps, dense breast tissue, estrogen exposure, obesity, height, alcohol consumption and radiation exposure. You would be wondering how height is also a major cause of breast cancer. Yes, women who are taller than the average height have slightly increased risk of having a breast cancer after the menopause. This could be due to the difference of hormone level in taller women. Estrogen exposure. Estrogen exposure is the menstrual cycle. Women who have started the menstrual cycle at younger age, that is before 12 or went through the menopause after 55, have slightly increased risk of having a breast cancer. Early detection and diagnosis of breast cancer. These are the early detection and diagnosis of breast cancer. A mammogram. A mammogram is an X-ray of the breast. It can detect the breast cancer up to 2 years before the tumor is being felt by you or your doctor. Breast MRI scan. Breast MRI scan is an imaging test that uses magnets and radio waves to check for the abnormalities in the breast. Breast ultrasound. Using high frequency sound waves, ultrasonography can often show whether a lump is a solid or filled with liquid. Experimental breast imaging. The other experimental breast imaging at earlier stages could be optical imaging test, molecular breast imaging. Biopsy. A biopsy is a test that removes tissue or sometimes fluid from the suspicion area. The removed cells are further examined under a microscope and further tested to check for the presence of breast cancer. Thank you.
So far we have discussed about the causes, symptoms, early detection and diagnosis of breast cancer. Once it is confirmed that a person is diagnosed with a breast cancer, based on the complexity and the severity of the cancer cells present in the body, it will be categorized into different stages. The stages are stage 0 to stage 4. Let us watch the video for clear understanding of it.
Hi, I'm Dr. Marisa Weiss. I'm president and founder of breastcancer.org. I'm also a practicing oncologist and mom and also a breast cancer survivor. So I'm happy to share information with you today that could help protect your life against breast cancer. Breast cancer is a complicated disease, and doctors often use a staging system to try to categorize different types of breast cancers and use that as a basis for treatment. So when everyone and anyone is diagnosed with breast cancer, we always want to understand what is the extent and nature of the disease so that each individual woman can get the best treatment that's tailored for her unique situation. When it comes to staging, there are actually 5 stages. Stage 0 is called ductal carcinoma in situ. It's a non-invasive type of breast cancer when there's an overgrowth of breast cells that is stuck inside of a breast structure. That's to say that the cancer has not yet learned how to invade or spread. Stage 1 is when the cancer is 2 centimeters or smaller without any lymph nodes involved. Stage 2 is when the cancer measures over 2 centimeters, but 5 centimeters or smaller, and there can also be lymph nodes that are involved. Stage 3 is when the cancer is over 5 centimeters, or when there is skin involvement or inflammatory changes, and there can be lymph nodes involved, and sometimes a lot of lymph nodes involved. And stage 4 is when breast cancer is called advanced or metastatic, when the breast cancer has spread beyond the breast and the immediate lymph node bearing areas, the armpit and the base of the neck. That's what's called stage 4 breast cancer. But regardless of whatever stage you or someone you're caring about is facing, there are treatments, effective treatments to manage the situation. So even if you're dealing with a more advanced type of breast cancer, don't lose hope. There are many different options out there for you to help you protect your life and hopefully overcome this challenge.
Now we are going to see about the treatments available for breast cancer. There are 2 types of treatments available for breast cancer. They are local therapies and systematic therapies. First we will see about the local therapies. Local therapies will treat the tumor without affecting the rest of the body. There are 2 types of treatments available for breast cancer in local therapies. They are surgery and radiation therapy. So in surgery, a part of a breast will be removed which is having the cancer cells. In radiation therapy, a high energy radiation will be used such as X-rays, gamma rays and charged particles to destroy the cancer cells. This is the effective way to destroy the cancer cells. Now, the systematic therapies. Systematic therapies will work throughout the body. They can reach the cancer cells anywhere present in the body. There are 3 types of treatments available for breast cancer. They are chemotherapy, hormone therapy and targeted therapy. First one is chemotherapy. The main goal of chemotherapy is to stop or slow the growth of cancer cells present in the body. The next one is hormone therapy. Hormone therapy can be done in 2 ways. One is by blocking the estrogen cells acting upon the breast cancer cells, Another one is by lowering the amount of estrogen present in the body. Next one is targeted therapy. It uses the drugs which will precisely identify the cancer cells and kills them. And also it uses the drugs which will interfere with the molecules which are responsible for the growth of breast cancer cells and their survival. Now we will see about the prevention of breast cancer. Some of the lifestyle changes can help us to reduce our risk of getting breast cancer. They are regular exercise, healthy diet, healthy body weight, breast cancer screening and breastfeeding. And these are the steps that has to be followed by each one of us to reduce the risk of getting breast cancer.
Hello everyone, now I am going to tell you how to do BSc. Before that, I will give you few tips to be followed. Do your BSc at end of your monthly periods. If you have irregular periods or you are in pregnancy, just choose a specific day in a month and do it on the same day for each month. You should not perform your BSc at shower or applying any lotions on your skin or your fingers. If you find a lump or unusual changes on your breast means, please don't get panic. About 80% of lumps are not cancerous, so just consult your doctor for further treatment. Let's go into the topic. Now let's see how to perform BSc. There are two ways to do BSc, one by touch, another one by look. Let's start with how to perform BSc by touch. To check your outer half of your breast, for example, we are performing for your right side, you have to lie down to your left side and then use your right hand on your forehead. Then use your left hand's 3 middle fingers flat pads to give a little circles from armpit to under your bra line. Then check carefully when you reaches the nipple areas and then you have to change the amount of pressure like lighter, medium and then deeper. So then you can feel all levels of your breast tissues to find your unusual changes. And then to check your inner half of your breast, for this position you have to lie down as flat and do the same procedure as before I said. But this time we have to start from collarbone to under your bra line. And then when you reaches the nipple areas, you have to check carefully where there is any changes or happen. Now how to do BSc by look. For this step you have to stand in front of your mirror and make sure that your shoulders should be straight. And then place your hands on your hip. Then check for the changes on the both breast. And next step, you have to raise your hands up and check for the changes on your both nipples. Is there any fluids are coming out? It could be like milky, watery, yellow fluid or bloody. So then you can find any changes or happen. Why breastfeeding is important for breast cancer? Breastfeeding reduces the risk of breast cancer and ovarian cancer, especially if a woman who breastfeeds for longer than 1 year. Breastfeeding have a lower risk of developing metabolic syndrome. A recent theory suggests that breastfeeding can reverse the changes that occur in a woman's body during her pregnancy period. What are all the changes? Increased fat storage, elevated blood pressure, cholesterol, triglycerides and increased insulin resistance. Breastfeeding can actually reset these changes. Thank you.